Hey y'all, it's all in good fun, and I promised positivity about this election. So let's all be happy that Donald Trump, he's going to fix health care. The first thing he's going to do, number one thing, he's going to appoint Robert Kennedy Jr. to head it all up. Now, RFK, he's not a doctor or clinician. He didn't go to med school, but he does know quite a few things. He knows a lot about drugs, because when he was younger, he was a heroin addict. Had to go to rehab maybe a couple times to get cured of his heroin addiction. He also knows about like brain stuff because he had a worm in his brain, a parasitic worm back in about 2010 that he said gave him brain fog. Well, I think the worm is gone. I'm not sure about the brain fog. Here's another thing. He says that he is going to gut the Food and Drug Administration. That's the organization that regulates the food and drugs that come to market so they can get there and be safe for our consumption. Well, once the FDA goes away, well, stuff might come to market faster. And so what? We might get E. coli. We might get listeria from food. We might get drug side effects or die. But it's going to come to market faster. The last thing, most important, RFK Jr., he's absolutely anti-vaccine. So to any of y'all who got your flu vaccine this year or get your COVID vaccine regularly or pneumonia or shingles or anything like that we older people get, well, that's all going to go away. Maybe it'll still be available at high expense to us. Anyway, let's move on. Donald Trump, he's promising to get rid of Obamacare. He promised that last time and didn't succeed, but, you know, what he wants to do is he wants to replace it with the concept of a plan. So you might ask what Obamacare is anyway. The official name of it is actually the Affordable Care Act. That was the plan that made it possible for all Americans to get health care coverage no matter their ability to pay for it. So millions of Americans got health care coverage who never had it before under the Affordable Care Act. The other provision of the act, it says an insurance company cannot deny you coverage because you have a pre-existing condition. And you might think to yourself, I'm healthy, what does it matter? But let's talk a little bit about this. What's a pre-existing condition? Well, diabetes is a pre-existing condition. 38 million Americans suffer from diabetes. That's more than half the number of people who voted for Donald Trump. A lot of those people need insulin or other drugs and treatment and maintenance to take care of their diabetes. Because in 2021, diabetes was a leading cause of death in the United States. It needs to get treated. Now, asthma is another pre-existing condition. That's all about the blockage of the air passageways. People with asthma, they find it hard to breathe sometimes. They need their inhalers or drugs to treat it. Well, that could be a pre-existing condition. They wouldn't be able to get treatment. That's 1 in 12 Americans, 28 million people. Then let's talk about cancer. In 2024 alone, there were 2 million new cases of cancer in the U.S. New cases. And the American Cancer Society anticipates more than 600,000 deaths this year of cancer. Well, cancer would be considered a pre-existing condition also. So anybody who ever has had cancer, whether they still have it or not, could be denied insurance coverage. Well, but you know, we're going to get a concept of a plan and RFK Jr., so let's all be happy. I'm all in good fun.